This is Impact Healthcare, people and strategies that are disrupting the health benefits industry. And now, here's your host, healthcare benefits industry expert and the originator of the transparent health benefits movement, Lester Morales.
Welcome to another solo episode of the Impact Healthcare podcast. I decided this year that I was going to start giving feedback and documenting some of business travel and sharing some of the insight that I learn when I'm on the road. I get to see some of the best things across the country, from specific strategies that are working in specific spots to seeing what employers are doing and pushing the envelope, and also seeing where parts of the country are more restrictive and/or kind of lagging behind what we might see. And I thought that this would be helpful for employers and advisors out there to hear real life stories about what's going on, and potentially sharing those pieces of the story with leadership, with employers, with hospitals or service providers, so that, what's going on over here versus what's going on over here, although there are some marketplace specificities, a lot of it is just that conversation hasn't started in that part of the market, period, the end. And so I wanted to first by highlighting a couple weeks back, I was honored to be the keynote speaker at the Memorial Care event. Now, this is an event that they do every year. Memorial Care is a large hospital system in Southern California. And the leadership of this organization is unreal, unmatched as far as I'm concerned. And the overall mindset of this healthcare system. Now, a lot of times in our conversation as advisors, I can name situations where I myself have maybe put the healthcare system as the villain, or at least culprit of one of the villains, in that the fact of, if you think about it, a healthcare system gets paid the more services that they do, right? They need to fill beds. And often we talk about the misalignment of incentives, and that the reality of it is there is no incentive for the healthcare provider community to actually do anything to keep people healthy. This system, however, completely runs against their salmon in the healthcare provider world. So this event, they invited employers, community leaders, and people in their marketplace to talk about not only what it is that they're doing, their expansions, their improvements, their values, their desires, but also they brought in speakers. And again, I was fortunate to be the keynote to talk about the evolution and the change in employer-based healthcare. And it was a remarkable conversation. They already have a what they call D2E, direct to employer strategy. And so in that example, they're already used to having that conversation. And some very large employers like Boeing is, one of their partners, where the employees in that market from Boeing have an extra incentive to be able to, go into the facilities that Memorial Care has in that market. What we talked about was a little bit different. It was, in fact, the opportunity to expand the offering and really focus on targeting and partnering with employers and advisors in that community that really care about changing the status quo. And the leadership, Barry and Dr. Kim, and other folks that I was able to meet there, blew my mind in the way they think. They don't think about profit first. they think about taking care of the patient first. And when you do that, obviously, nobody cares if you make profit, right? So if you add value in your KPIs, your measurement stick is making people healthy, happy, more productive, then everybody else in the food chain is okay when you make a couple bucks to do so. So the main takeaways I think that are helpful for folks is number one, bringing employers and healthcare providers closer to the conversation together. Now, if you think about it, who decides how much that MRI costs? Who decides how much that knee surgery? In today's normal model, that is between a health insurance company and the healthcare provider community. And those two folks are definitely at odds because at the end of the day, they kind of both want in cost to potentially go up. And, if they're fighting for, let's just call it the premium dollar, right? Because of premium, some of it stays with the health insurance company and some of it gets paid out to pay for claims. So if we're talking about a dollar, then there's a tug of war of that dollar. And I think that when we bring healthcare providers closer to the employers, the real payer of healthcare, by the way, and it drives me bonkers when people call the insurance companies the payer. They're not using their money to pay for anything. There are premium dollars that are paid by employees, by employers. There's government dollars by Medicare, Medicaid that is actually funding insurance companies. They don't put their own dollar on the table. So let's stop calling them the payer. The payer of healthcare in an employer sponsored plan, whether it's fully insured or self insured, is the employer and their employees. That's it. When you bring these people together, and understand the real financial transaction that occurs, a hospital doesn't collect 100% of what is actually charged. They need to charge X to then get Y collected. And so if we understand that on this side, the employer side, we call it a deductible, a co-insurance. And on this end, because most people don't have $3,000, $5,000 in the bank. The reality of it is they call this an accounts receivable. A hospital calls a deductible accounts receivable. So if the employer doesn't want to charge their employees a deductible, they would love to give a better benefit. The employee can't afford to pay it and the hospital doesn't want to collect it, then why in God's green earth are we actually charging it? Why don't we sit down together and talk about an MRI? This is what it costs. You need to make a profit for it. And what if we were able to not charge an employee a deductible or out of pocket if they come into your facilities, Mr. Hospital, in this case, Memorial Care? And if that happens, you don't have to chase the dollar. It doesn't cost you anything to chase that dollar. You get your money faster. So the reality of it is that is better from a financial transaction standpoint. And that is a value. It's a value for the hospital. It's a value for the employer. It's a value for the employee. So Memorial Care and the event was second to none. It was immensely, immensely well done. The team at Memorial Care, Rachel, Chris, the rest of the marketing team, the rest of the leadership team, and then speakers that I got to share the stage with, Emma Fox and Stephanie Koch, and some local advisors there in the Southern California market. It was just a great event, and I highly recommend. Again, my call to action and my observation was where in markets where hospitals would simply pick their head up and say, I would be willing to have this conversation, and where employer and advisors would pick their heads up and says, that's an interesting conversation. I want to partake. Let's break down the barriers of people getting in that same room and having that conversation. Because if we understand what a deductible is called an accounts receivable. A hospital spends, 20, 30, 40, 50, 60 cents on the dollar trying to collect the dollar. Well, it seems like there's just a better thing that we can do for everybody involved. So direct contracting, getting closer between employers and the healthcare community in their marketplace is just such a good strategy. And I was proud to be part of that event. My travels then took me um, up to Napa Valley, where I did more than just drink wine. Don't worry. It was the MedTrans annual event. MedTrans is a single parent employer based captive. A captive is essentially an insurance company. And one of our clients is one of the newest members of the MedTrans captive. And my takeaway in this was when you, as the risk bearer, so MedTrans being the captive, they bear risk. Um, they have sought out both employers and advisors that truly care about the future, that truly care about changing the status quo. So typically in a room where some questions about the structure of somebody's health plan is given. Hey, who in the room utilizes the big carriers to administer your program? Most of the time, a room is going to be 70, 80, 90, maybe even 100% of the room raising their hand. In this room, it was probably 25%. Who's using one of the big PBMs, the big pharmacy benefit managers? Again, most of the time that answer is 80, 90% of the room. In this scenario, it was, 30, 40%. I was so impressed. And so if those people, and I want everybody to think through this logic, those employers, those plan sponsors have decided, I want more risk. They want to get into the insurance game. They laid down their deposits, collateral. Some people call it collateral, their membership obligation to be part of the captive. So they're betting on them. They're participating more. So they're not backing away. They're not saying, I don't want to be a part of this. They're actually doing the opposite. They're saying, I want to be such an active member of managing my second or third largest expense that I'm willing to put more money on the table to manage it better to then get more money back. And I just love that mindset. And the advisors that are talking to that particular strategy with their employers are advisors that are not looking at their back end bonus. They're not looking for the easy button. They're looking to drive value. And when you get service providers, the captive, the TPA, the PBM, the medical management, the different spokes of the wheel, in the same room with plan sponsors and advisors that are all looking to do what's in the best interest of the patient and helping that patient get the highest quality, lowest cost care, navigate the healthcare system, make it easier for people to access care, get closer to the provider community, and all the other levers that there are to pull. Magic happens. And my big takeaway was in our business, a lot of times we talk about anti-selection or adverse selection, which is like, hey, only the really bad risk are going to like this for whatever reason. So we're getting adversely selected against. In this scenario, we're getting positively selected against. And so, Phil, the leader of MedTrans, has done a phenomenal strategy, whether he meant to or not, making sure that he is exposing and pushing, encouraging, even sometimes mandating that employers who join the captive are doing the things to proactively lower the cost of their healthcare program. And when you think about a captive being a swimming pool, Well, knowing who's in your swimming pool and in fact only inviting the people that you want in the swimming pool because they've showered before and they are doing all the right things. They're people ain't peeing in your pool. And when people don't pee in the pool, it's a better pool. And I just thought it was such a amazing fellowship opportunity, sharing opportunity, advisors who might be otherwise competitors sitting in the same room and talking and sharing strategies. It's just such a great event. So a big props out there. So my takeaway for employers and advisors is if you're truly um wanting to walk the walk and put the money where your mouth is, MedTrans, a single parent captive, at where you are really in a group of people who are looking for the same things that I think are phenomenal. My third stop, and it was a long, 2 weeks, was in North Carolina. The spring event for the North Carolina Coalition on Health. And John, who runs that, wanted me to run an employer workshop. Employers in that room were ranging from a couple of hundred to 15,000 lives. And we talked about all of the strategies that are pushing. And my big takeaway on this is the various, business groups, coalitions, alliances, every state calls them something different. Um, that employers that are a part of this are starving for knowledge and exposure to things. And so, although I love the correlation of the state-based stuff, I really commend John for bringing us in that have a little bit more global of a view outside, and can push. And that session was with no other advisors. And so, um, I like to take the approach where an unfiltered, explanation, education, not talking poorly about anybody, not trying to win business, because that's not what we're there to do, but an unencumbered approach in education where employers are like, man, I need to ask better questions. I need to demand more. Look at what other people are doing. Allow from a different perspective. It was a great session, and there was a lot of value that can be created. And so there was employers that wrote, pages and pages and pages of notes. I got emails and text messages over the weekend about it. And so if you're an employer that is not part of your state's coalition or alliance or business group on health, I would strongly advise you to, consider if you're one of the alliances, coalitions, business groups on health, and your employer demographics that you target is only the bigs of the bigs. I love that John he's got small members, big members, everything. And in our dinner was the person who runs the state program, and even he was talking about, hey, we need to all work together. And what I love about the collaboration is no one's pointing fingers, no one's talking about, well, that seems hard. Everybody's looking for something that is different. So if you're an employer and you're not part of your local state chapter, I would recommend you searching that out. If you're one of the chapter leaders, I would really encourage you to look at the product that you're putting out in the marketplace, and is it wide enough to represent the people who really need help down in the trenches. And if you're an advisor, I was a little disappointed in the fact that so many of the employers that were in that room had not been exposed to some of the strategies that we talked about: transparency, steerage, advanced primary care, captives, international sourcing, manufacturer assistance programs, all the levers that there are to pull. And so, as advisors, we just need to do better. We need to take our own value and own interest out of the way and really push to make that exposure, even if it means that we're doing more work. And I'll leave everybody with this. Often I ask advisors, about these strategies. And a lot of times, the advisor might be thinking, man, it's already my client. If I do this, I'm not making any more money. I have more work that I'm going to have to be doing. And if this doesn't go exactly well, I'm putting myself at risk because, at the end of the day, clients don't like friction. And I got to just challenge everybody who can hear my voice that says, um, if because we think something is gonna be hard, if because it doesn't work as smoothly as we would like in the beginning, because there is more work, we're never going to push the envelope enough. And so I really advise everybody to look at this a little bit different and look at this from a long-term perspective and look at the various levers that there are to pull and more so the underlining reasons why these levers might be valuable to pull and really start looking at this from a different lens. Advisors, your clients will pay you more money if you save them money. So think about that. If your client's paying $5 million and you're making $100,000 and you put in a new program and now they're paying $4 million, do you think that your client would be willing to pay you $150,000? It's just we've never been asked that our compensation as advisors is directly correlated with the value that we have been adding. We have hidden behind commissions where we're getting paid not by the value that we are creating, we're getting paid by how much money they're paying. So if we really want to sit at the big boy, the big girl table with the accountants and the attorneys and the auditors and those other professional services organizations, we must drive that respect by putting our money where our mouth is. And so I just commend John for putting that together. Everything that I was exposed to was fantastic. Um, and my summary is it was a long couple weeks, but the value and the things that are going on in three different marketplaces with employers from coast to coast, north to south, small to big, really makes it encouraging. So if you want any information about any of these organizations, if you're a hospital and you want to have conversations about how other hospitals are doing this and how we can all drive value together, please reach out. If you're an advisor and have any questions, if you're an employer, you have any questions, the only way we drive change is by more people knowing more things. So I hope that this podcast brought some light. I commend all of the folks for being leaders and being that trailblazer so that others can follow. If you haven't consumed any of our other podcasts, Impact Healthcare, there's lots of things for lots of people to learn, and all we're trying to do is expose more people to the things that could actually impact healthcare. Thanks so much, and we'll see you on the next episode.
You've been listening to Impact Healthcare, people and strategies that are disrupting the health benefits industry with Lester Morales. Remember, the journey to getting 20% savings on your healthcare benefits starts with total transparency. Remember to subscribe to the Impact Healthcare podcast on iTunes or wherever you get your podcasts.